Good afternoon. My name is Joe Burns. I am the Health Beat Leader for health insurance. I'm so glad you could join us for this webinar today. We have two really terrific speakers on a great topic. Charles Ornstein is the managing editor for local news coverage, and he oversees ProPublica's local initiatives nationwide. And Sabrina Corlette, who's a research professor and founder and co-director of the Center on Health Insurance Reforms at Georgetown University's McCourt School of Public Policy. So we'll begin in 1 minute. I just want to do one housekeeping thing, and that is to suggest, to recommend strongly that if you have a question, please enter it in the Q&A and not in the chat. It's very tempting, I understand, to enter it into the chat. I've done that myself, but we really want them in the Q&A. It's much easier to manage that way. If you want to send a link, you can chat it to Catherine Reed, who's our executive director, not the executive director. She's the managing editor for this, not the managing editor. All right, I messed that up. Anyway, she's working behind the scenes on this webinar for us. And so without further ado, we'll begin. I would just like to point out that we have, she's the Director of Education and Content for AHCJ. She's also my boss, and that's title I should know. So anyway, we'll begin. The Sabrina and Charlie have both worked diligently with others to produce our brand new health insurance guide, which went up in December, and it's really thorough. It covers all 50 states. It covers all the different ways that health insurance is provided to Americans, Medicare, employer-sponsored insurance, the ACA, you name it, it's in there, and it's covered, and it's explained in great detail, and it's highly readable. I found it to be very useful, and I think you will too, especially for someone who's new in a state or new to health journalism, or even if you have been doing it for a long time, you will find a lot of useful data in there. And so we will begin with a presentation from Charlie, and then we'll turn it over to Sabrina. If you have questions, you're welcome to put them into the Q&A and not into the chat. We'll also take some time at the end, after Charlie and Sabrina have spoken, to talk a little bit about to answer your questions. That's what I was trying to say. So anyway, let's begin. Charlie, if you want to take it over from there, you're welcome.
Great, thanks. Thank you, Joe. Thanks, Catherine. And it's good to be here with Sabrina as well. So when I think about the role of health journalists covering a community, working often for a local news organization, there's so many different things and so many types of stories that you can cover. I've written a lot about hospitals, as I'm sure a lot of people on this call have, written about the quality of the medical system with respect to doctors, written about nursing homes and elder care. But when it comes to covering insurance, it is one of these sticky things that I know me and many of my colleagues over the course of time have said, I don't even know where to start. This is so complex. There's not a place like a hospital inspection report that you could just turn to, and every state uses the same type of report, and you can get them all from the Centers for Medicare and Medicaid Services, and you can get your arms around it, right? Health insurance is complex. Some may say complex by nature, in order so you can't get your arms around it. And there's so many different areas to cover. So I wanted to first sort of lay out, as I think about it, the types of health insurance stories that are out there. Why sort of this idea of a guide came to fruition, and then Sabrina, I know, is going to walk you through the guide. So when I think about health insurance, like, so many different areas of coverage come to mind, and I think that we should separate them and think about them in different buckets because it helps to conceptualize stories about them. So the first, obviously, is the marketing of plans. That essentially your first interaction with a health plan is often how they're marketing to you. And there are lots of rules regarding how health plans can market, and they often violate the law. I wanted to share with you a report that I'll put on the screen here that was written by the majority staff of the Senate Finance Committee that looked very specifically at deceptive marketing practices within Medicare Advantage plans. But I show that to you really because it's an issue that is not just true for Medicare Advantage plans, but for other plans. And as it is often the very first time you interact with a plan, what you're advertised and then what is delivered on is a huge part of it. And so that's one thing that I have on my list. The second thing I have on my list is how much health insurance costs. What are their rates? And there's a whole lot of information that's available. Sabrina will share some of it with respect to how you can get information about the rates that health insurance plans charge, how they compare to other plans within your community, and information just about cost profits brought by health insurance plans as well. The third area is networks, that different plans have different rules with respect to offering hospitals and doctors that are available to people in their networks, and health journalists can do a great job in ensuring whether they actually follow the rules that they're required to. Health plans can get in trouble for that, and Sabrina will show you how do you find examples of health plans that perhaps are getting in trouble for that. Another area that I've written about a number of times in my career is fights between doctors and hospitals and insurance companies. This is a time in which, oftentimes people will proactively come to the media and try to get your attention. And so these are the types of insurance stories you often see. But there's a lot behind those fights. And it's one thing that I've sort of put on my list as I think about possible insurance stories that you can tackle. Another are the rules that health insurance plans put in place, particularly rules involving prior authorization. Folks on this call may have seen the Biden administration put out new rules, I think just last week, that will redefine sort of timelines with regard to prior authorization. Prior authorization is a bane for a lot of patients in health insurance plans. They pay close attention to it, and there are really good stories that can be written about that, as well as some data that you're able to tell, particularly in some government plans with respect to how often prior authorization is used. Another area is denials of care. Patients are often very, very frustrated when their health insurer denies them coverage. ProPublica did a big project on health insurance denials last year, and one of the things we did was create a tool, which again, I will share on screen, and I'll share these links with Catherine as well to share at the end of the call. But we created a tool that enables you to, patients actually, to request their claim file. The patients have the ability to get their claim file from their insurance companies, which can include audio of calls they have with insurance representatives, all the internal correspondence, the doctor reviews of their claim, and that information can really help you in terms of writing a robust story about what happened in a particular claims denial. The last thing I wanted to note just in general about stories is that insurance is regulated at the state level. So it is in many ways like doctor regulation, which is also at the state level. But the complexity with insurance is that it's regulated at the state level unless it's not. That many people in the country get their plans through their employer, and those plans are regulated under a law called ERISA, which is a decades-old law that governs plans that are offered oftentimes by employers that operate in multiple states. And so the Department of Labor gets involved with that. And so it's not enough to simply understand what your state health insurance department is doing. It's also important to understand what the Department of Labor is doing with respect to ERISA. I wanted to, before turning it over, show you a couple sites that I think, for me, whet my appetite when it comes to what you can dive into when you begin to look at records your state keeps on health insurance. And so the state I wanted to show you on is California, which actually has a lot of information that's available online that's really friendly if you're a reporter looking for information. So I wanted to show you two things. The first is if somebody is denied care by an insurer and chooses to appeal, the first place they start is within the insurance company, appealing to get the care overturned. They can eventually appeal to what's called an external review or an independent medical review organization. In California, when that happens, that information is put online in a searchable database. And so I want to show you what that looks like because there's a lot of really great stories in that database. sorry, this is just changing tabs here. So as I mentioned, California has a website that enables you to look through independent medical review decisions. And what I typed into to here was the words Ozempic, that I was looking for recent independent medical reviews that included the words Ozempic. And it pulls up the decisions that are made. You don't get information about which plan it is or the name of the person who appealed, but you do get information about when the decision was made, what the variables were that were included in the decision, and what the independent medical reviewer did. So when you're looking here at Ozempic, what you're able to see is that quite often, actually, the independent medical reviewers are overturning the decision by the health plan related to Ozempic. So if you are wanting to work on a story about how are insurance companies dealing with Ozempic, which is a really new and hot topic, using independent medical reviews is a good way of getting information on that, and then having really personal information that you can include in a story. The second thing California does that I like a whole lot is that they post their enforcement actions online, meaning this is the actions that they take against insurance companies who are not following the rules. Again, I can share this information with Catherine, who can share it in the chat. But essentially, what I try to do is just look for the violations that were issued by California in the last year. And you can see that they've taken 118 enforcement actions. Many of these are not actions they're going to issue press releases on, which are big multi-million-dollar actions, but they nonetheless affect the lives of people. And they involve violating the rules that the state has for operating a health plan or a managed care plan. This is involving grievances and appeals. It gives you, definitions of what it's about, and you can actually read the letter itself that was sent to the health plan for violating the rules. So one of the nice things that Sabrina's guides do is for each state, it points you to where those resources are, which is amazing. So the last thing I wanted to do before turning it over is just talk about the genesis of the guide, because this is a great case of working together. I had been stymied because I felt like there just wasn't a place that a journalist could go for information about where are all of these tools within each state. And it was a little bit of stumbling around to get the information. I had a conversation with Kathy Hempstead at the Robert Wood Johnson Foundation, who said, I'm just the person who can put this together. And thus a match was made with Sabrina and AHCJ when I spoke to Felice and Catherine was really interested in hosting this. And so that's what you have today, is a super valuable tool that can help you in so many contexts to understand health insurance in your state and around the country as well. So I'm going to share these links with Catherine, but I'll turn it over to Sabrina.
Great. Thank you, Charlie, for that very kind introduction, and Joe and Catherine and everybody for facilitating this partnership. So I will kick us off. First of all, just to hopefully folks can see my screen. Just for folks who are not familiar with our center, we are located at Georgetown University's McCourt School of Public Policy. And we do legal and policy analysis on health insurance and how it works for people. We do a lot of different research reports and studies. We do a lot of blogging, and we provide technical assistance, but all with an eye towards, how the average consumer navigates the system in terms of accessing insurance, affording insurance, and then using their insurance. I also would remiss if I didn't mention our sister center, which is the Center for Children and Families. And they focus particularly on Medicaid, the Children's Health Insurance Program, and drug pricing policies. And we really are, sort of two groups that work in tandem on key aspects of our system of health coverage. So turning to the media guide, and first of all, I really want to thank both Charlie and Kathy Hempstead from the Robert Wood Johnson Foundation for bringing this project to us and to AHCJ for making it a reality. But as we embarked on this project, we first of all wanted to think about who this was for. And we wanted to design something that would be useful for journalists who are brand new to the healthcare beat. And so just trying to understand some of the concepts and different ways that the laws and rules work, but also for much more seasoned journalists who have been doing this work for a long time, but maybe want to get a refresher or get up to date on something or find out where some of the key data sources are. So we really wanted it to serve both the new folks and folks who are much more seasoned. And why we wanted to create it is, as Charlie mentioned, and Joe, the health insurance system in the United States is incredibly complicated. There are huge variations state to state. And also, there are just so many important stories to be told about patients' experience, of consumers' experience. And we really need journalists who can tell those stories. And we wanted to make it easier for them. So what is the guide? I will show you in just a moment, but essentially it is a national overview. And then it is let me see, I gotta go to my screen. Stop share. And so now I'm gonna switch over to the guide itself. And walk you through a few key components. Right. So hopefully folks can see my screen. But we start with the national overview. And so if you go to the homepage, and Catherine will share this link, we start with an overview. And this document essentially starts with a table of contents that is interactive. So you can click on any of these headings and it will take you right to the section of the guide. But essentially what we wanted to do was start with some coverage basics on a national level. Who is covered under what program? We provide links to, anytime we cite a particular piece of data, like how many people are covered in a certain program, we provide links to the underlying data source. And then it's just sort of a 101 on, for example, Medicare or Medicaid. And for each section where we provide those basics, we offer some other resources for folks who might want to dig deeper. So for example, here for Medicare, we offer a few sources where you can dive a little deeper on what Medicare is all about. We then, in another section of the guide, once we get through all the different sources of coverage, and in the United States, we have multiple different sources of coverage that somebody might have. The next big section of the guide takes you to who are the key agencies and officials responsible for monitoring and ensuring compliance for health plans and health insurance companies regarding who's covered, how they're covered, and for protecting consumer rights. So in addition to this section describing who regulates what and the scope of their authority, as Charlie mentioned, we also provide links to relevant databases that are maintained by these agencies, and also how you can reach them. So for example, with respect to the Centers for Medicare and Medicaid Services, which is the national agency that oversees Medicare, Medicaid, and the marketplaces, we provide a link to their regional offices around the country, as well as a number of the databases that they maintain. In the next section, after we get through all the various agencies at a national level that are responsible, we wanted to have a section that's designed to help you if you're writing a story that flows from a particular consumer's complaint or problem with their health insurance. Where and how can you as a journalist learn more about the underlying issue? And where can a consumer or you turn for help in getting assistance with their problem, and then how are they contacted. So this section, sorry, that's here. This section gives you all the different things that you might go to learn more about the consumer's coverage, as well as what the underlying issue or source of the problem is. And then we wanted to share sources and resources for places to go to provide consumer assistance. And then the next section, really gets to, as Charlie mentioned, the health insurance industry is incredibly complicated, and there can be multiple layers of entities between the policy that is held by an individual consumer or employer and the entity that bears financial or legal responsibility. So this section just provides some background on the different types of legal entities that you might encounter in your reporting. And then also in this section, we include some non-governmental sources of data on health insurance companies. For example, a big important one is the National Association of Insurance Commissioners, which maintains a number of databases where you can get, for example, data on complaints that are filed against insurance companies. And then we have a couple of appendices, a glossary of key terms, because of course, with healthcare, there's just an alphabet soup of health insurance terms that you'll need to familiarize yourself with. And then the other item in the agenda, which I'm constantly referencing, is a federal poverty level table for 2023. And that's because in the United States, the kind of coverage you have quite often depends on your income level. And that's often, when you're talking to like a government person, they'll measure it in terms of percentile of the federal poverty level. So that's the national overview. And then next I want to take us to, and I just need to figure out how to do this. I'm going to take us to the individual guides. And we'll do just a couple of quick examples, because obviously we cannot do all 50. But as if you've ever done state-specific reporting, you know that if you've seen one state, you've seen one state. So really, impossible to sort of provide generalizations across states, but we tried to make each state fact sheet as uniform as possible. But just to give you an example of the kind of thing that you'll find in our state fact sheets, we'll start with Texas. We provide a state level overview of where Texans get their insurance coverage, and for state operated or regulated forms of coverage, which agencies are responsible for either regulating or running that program, what those agencies do, and who they cover. And then again, as with the national guide, for each statistic that we cite, we provide a hyperlink to the underlying data source. And then just as we did with the national guide, we wanted to give you links and information about the state level agencies. And so we for each agency, we describe what they do and their scope of their authority, as well as any publicly accessible databases that they maintain. I will say that California is a bit of an outlier in terms of how much data and publicly available data that they provide. I would say, based on our review, most states are not as transparent as that. And then last but not least, we wanted to provide other non-governmental sources of information. So Texas is just one example. Of course, states are very different. So just to give you one more example, I'll show you California. And as Charlie mentioned, I'll skip through this section here is just like we did in Texas, just describes the sources of coverage for Californians and a little bit of background about that. But as Charlie mentioned, this is a state that provides some great sources of data on health plans and their behavior and actions against them. They also, unlike Texas, have they run their own health benefit exchange or Obamacare marketplace. And they have an office of a consumer advocate. So there's just a number of additional government level agencies that you don't necessarily see in a state like Texas, that we wanted to provide information about and links to. So in a nutshell, that's the guide. You can explore on your own, and we encourage you to do that. I do just want to say, as my sort of last thing is, it's we at CHEER, we take full responsibility for any and all mistakes or errors that are in this guide. We have tried our very best to ensure that all of the links work and the data is accurate and up to date. But we hope you will reach out to us if you see anything missing or any issues or problems with the guide. We are hoping this is just version 1.0, and we're going to be hoping to continually improve it and make it much more user-friendly. And of course, to do that, we would love to get your feedback and thoughts on how we can make it more useful to all of you in your work. So thank you for the opportunity.
Sabrina, thank you very much. You raise a really good point about how you welcome comments from journalists who use the guide, and that makes perfect sense to me. So it sounds to me like you're kind of going to be crowdsourcing the next version, or you're going to be ongoingly revising it, or how does that work?
We would love to be able to do that. I can't make any firm commitments without talking to Robert Wood Johnson Foundation about what's possible. I will say, you know, we had this initial dream of making this like almost like a wiki, so that the users themselves could update it and improve it with some moderation. Unfortunately, we didn't have the technical capabilities to do that, but I certainly, you know, if you catch, at least for this, you know, first go round, I really hope people will email us and let us know if they see any mistakes or big, you know, glaring omissions, because we would obviously want to correct that right away. Over the longer term, if people do find this a useful resource or have ideas on how to make it more useful, we would love to build on what we've created.
That'd be great. Should we add an email contact in the document itself, or under each state, or what do you think?
Yeah, I think there is one on your site. Maybe we can share a link to that after the webinar, but I recall that should be an email address there.
Okay. So Sabrina, well, what surprised you from building this resource that even you as an expert were surprised about? I don't know, complexity. The complexity always throws me. Or what other issue was surprising?
Well, you know, anybody who's covered healthcare knows there is variation state to state. I think what was most surprising to me was just how vastly different the resources and publicly available information is state to state. So there are really a number of states where, I mean, I feel sorry for you if you're a journalist trying to get to the bottom of something, because it is so opaque. Almost nothing available in terms of, you know, how these plans are regulated, where the complaints are, what's going on. And then, you know, there are other states that do a fantastic job of, you know, for example, sharing reports on market conduct exams, which are where, you know, regulators go in and look at compliance issues. So there is just a vast difference at the state level in the level of transparency.
Does every state do?
Can I just jump in on one thing on that, Joe?
Go ahead,
which is, I think, you know, the tendency may be to look only at your state to see what's made available, but I actually think what's helpful is when you look at other states, particularly neighboring states, if your state doesn't make information available online, but you know neighboring states do, it can make for help you write a public records request to ask for specific things like market conduct exams. If you know that they are done and that some states make them public, it's worth it to put in a request in your state to ask for them. So don't stop at your state. Look at around your state as well.
Oh, that's a good point. I found that I might be cynical in asking this question, so correct me if I'm wrong, but I find that some red states are not as good as some blue states. Like California, you mentioned, Connecticut. I've done stories about their Department of Insurance and their Medicaid programs. Iowa is a red state that didn't seem to do such a good job, and they weren't as opaque. The reports weren't as easy to follow. And the staff in those departments, the PR staff in those departments, weren't very. Texas the same way, by the way. Texas and Iowa, both red states, where getting information was difficult. Is that me being cynical, or is that a true-ish fact?
Well, I don't have like a scientific answer for you in a sense of like, these are the states that do a great job and these are the states that do a poor job, because we didn't compile that list. My impression is, however, that the red states tend to have fewer publicly available resources. That could be a funding issue. I think quite often the regulatory agencies are not as well funded in red states. But I don't, oftentimes it doesn't cost all that much to put a bunch of links on a website to reports that you're doing. So I do think that in some states there's just, for whatever reason, a culture of transparency, and I don't know that that's necessarily a red or a blue issue. But there certainly are some states where that seems to be much more part of the government culture.
Yeah. Funding is a good reason that might answer a lot of those questions. Charlie, you talked earlier about prior authorization, and ProPublica has done some great work on that issue. It's a very, very big issue now, as you mentioned. The White House just issued new guidelines on that topic, and it's a big story everywhere, particularly for patients who have high cost illnesses or patients just trying to get the coverage that they deserve. What would you recommend? Does this guide, can you talk about how the guide helps journalists cover the prior authorization issue?
Sure. I mean, when it comes to prior authorization, the single most important thing that I think people should take into consideration is truly understanding what type of plan somebody's enrolled in. That people often don't know the type of plan they're enrolled in. They often get it wrong. And so I regularly, as I'm talking to folks, will ask them, can I see your insurance card? Can I see your explanation of benefits? Just as you wouldn't write about, say, a medical error without seeing somebody's medical record, you definitely want to understand the type of plan, because there are different rules, there are different protections based on what type of plan somebody's in, whether it falls under the oversight of the state or the feds, whether it's a Medicare plan or a Medicaid plan. So I devote actually a lot of attention on the front end to just really getting the bearings straight, because it takes you in 42 different directions depending on the answer that you get. But I do think it's incredibly important for, insurers like to make the point that we are not deciding whether you can get the care or not. We're just simply deciding whether we will pay for the care or not. But for many Americans, that's a distinction without a difference, right? If your insurer will not cover it, you will not get it. And they may say that they're one level removed, but it has that practical effect, and you see that happening. So from my perspective, getting as many records as you can get is the first step in dealing with prior authorizations, trying to understand, if there are rules or laws covering whatever type of product it is, whether it's Medicare, Medicaid, private insurance, federal insurance. And, also, in some of these cases, it is more than just a one-off thing, that it can be something where the insurance department has taken action against them before, where they potentially have been sued under that law that we had talked about, ERISA, that federal law that governs plans that, that are offered by employers in multiple states, for example. People can sue if they are not getting the benefits that they want, or if they're having a problem. Those lawsuits can be found in PACER or in the federal courts. So I think that there's lots of ways to look to see if this is a one-off or a pattern. And that's the biggest thing that I would recommend in looking for with prior authorization, is really trying to understand, is this indicative of a bigger problem, or is this specific to this case?
Yeah, and I would
That's
just
really useful information. I'm sorry, go ahead,
yeah, no,
Sabrina.
I would just quickly add in terms of how the guide might be able to help for something like that. I think one thing it helps to do is connect the source of coverage to the regulatory framework that governs that particular company or plan that the person has, and then whatever regulatory agency that is, how to navigate that agency. So.
I'd like to ask about the No Surprises Act, because that seems like a very important law, and yet implementation has been, I don't know, slow, or I don't know what the word for it is, because it's worked its way through the courts. Do the states handle the No Surprises Act differently? Do some states do a better job than others? How would you both answer that, do you think?
Yeah, so it's a bit of a mix. And again, this all depends on the source of coverage. If somebody is in a state regulated plan, in many cases, the state is responsible for ensuring compliance and consumer protection under the No Surprises Act. But as Charlie mentioned, a lot of people are in what we call these self-funded employer-based plans that are regulated under ERISA. In that case, the agency responsible is the U.S. Department of Labor. So if you're a reporter trying to figure that out, you got to figure out whether somebody's in a ERISA fund, regulated plan or a state regulated plan. The complexity with the NSA, of course, is that it's not just plan behavior that's being regulated, it's provider behavior that's being regulated. And in a number of states, the state has said, we don't want to have to regulate the provider here. We want to leave that to the federal government. And so in a lot of states, it has fallen to the Centers for Medicare and Medicaid Services actually to be the lead regulator.
And Sabrina, correct me if I'm wrong, but I actually think, haven't the number of disputes filed under the No Surprises Act far, like many times exceeded estimates?
I can't remember the exact number, but it's hundreds of thousands of complaints under the dispute resolution process. I will say this, however, there is evidence that for the patient, the law is working in terms of the patient is not getting the surprise balance bill, that providers are largely compliant with that portion of the law. What's happening is these disputes between the provider and the plan are getting taken to this resolution, the IDR entity, the independent dispute resolution entity. And that's where things are getting really bogged down.
Yeah.
I found that it's useful to get to know the PR staff and all the different agencies, particularly in the states, but also at the federal level. Like, I would think the Department of Labor people, if you started there, that would be a good place to start, with the DOL public relations staff. What do you, and the same with CMS. What do you think about that, Charlie?
I actually think that you will likely have more luck at the state level than the federal level. Unfortunately, in successive administrations, both Republican and Democratic, these federal agencies have gotten way more bureaucratic, way less willing to talk to you, even on background, and to provide you guidance, pushing you off to FOIA, which can take a really long time. I think even in whether your state is run by a Republican or a Democrat, I think they're closer to the ground. State insurance departments are not they don't often get inundated with reporter calls. And so I think you will have a better shot at starting there and working your way up to the feds if the state can't give you the answer you need.
Yeah, and I'd also say that if a company is engaged in some sort of behavior that's not compliant or that's problematic, chances are they're not just doing it for their ERISA plans. They are probably engaged in similar behavior for their state regulated plans. So you're not, can't generalize, but a lot of your state regulators will be aware of of the issue if it is a systemic one, and can comment on it, even if they're not directly regulating a particular plan by that company.
We have a question in the Q&A from Emily Woodruff. She wants to know your thoughts on how to cover short-term insurance application denials for a history of taking certain preventive medications. Can you talk about that, either one of you?
Sure. And I'm happy also to talk offline about this, but in most states, short-term health insurance, those companies are allowed to deny people policies based on pre-existing conditions or their health status, because they are not regulated under the Affordable Care Act. That's not true in every state, but in a lot of states that is the case. And we do talk a little bit about that in the media guide.
And were there new rules just issued about short-term insurance plans?
Proposed, but they haven't been finalized.
Right, thank you. Yeah, so that
the challenge on short-term plans, right, Sabrina, is that, you know, as administrations change between parties, they seek to redefine the rules about short-term plans and the duration of those plans. So it really does feel like it's been a bit of a ping pong.
Yes, yeah. In terms of how they're regulated and how they work for folks, I think one of the problems is that they're often marketed to consumers as if they are traditional health insurance when they are not, and they cover often only a fraction of the services that a traditional health plan would cover.
Yeah, buyer beware, and don't ever get sick. Do you have any advice for journalists? This will be our last question. Any advice for journalists trying to get information that should be public, but that isn't released? You know, and you get run around from officials. My colleague Liz Siegert asked that question. It's a good one.
What I often say is, like, try to start with an example and work your way with somebody who's willing to help you. So if you have a patient who's having problems with an insurer, have them put in a request for their claim file, have them give that claim file to you. You want to understand what is happening sort of on the other side of what is a really opaque process. And I don't think that that regulators are your first step to doing it. I think you want to find somebody who's willing to, like, walk in the door with you to get you information. And then that can give you a sense of, oh, I didn't realize there's this third level of things that people go to. And so I want to start inquiring about that. The other thing I'd recommend is trying to look for former employees who worked at an insurer, particularly in the division you're talking about. You know, some of them may be bound by an NDA and won't be able to talk to you, but some may have perspectives and opinions. And some of the sort of most vocal patient advocates have been people who've worked for insurance companies, you know, and then subsequently leave and start speaking out about their practices. So I'm not saying that's going to always happen or will happen in your case, but it is definitely a good idea to include looking for, you know, people who used to work at the companies on your list.
One other thought I had is, this is less helpful on the government side, but I have found over the years that there are some health insurance brokers, and these are individuals who often sell, or who are in the business of selling health insurance, but a lot of them are really savvy about, like, marketing behavior and kind of where the bodies are buried in the market in terms of, like, who the players are. And if you can find a good one who's been around the block a bit, and you know, they can often be very, very candid about, you know, who's doing what in the industry, and I found them to be very good sources. Although you know, you have to sort of do a little homework to find people who are good and able to talk to you about that stuff.
Yeah. Do you, one last question. Do you think patient advocates are useful? Because sometimes you go to them and they really know the ins and outs of insurance and hospitals and how to get the most from both of those
Absolutely.
sides of the coin. What do you think?
Yep. Patient advocates, and and also the navigators and others who are working directly with consumers. Yeah.
Yeah, and I would add one other tier of folks, which are the people who you can hire to help if you're having a problem with your insurance company, and they are, you know, sort of, they don't help you sign up for a plan, but they help you sort of navigate particularly really expensive appeals. If you're being denied a transplant or something like that, you may hire somebody to, and there's a whole, I'm blanking on the name of the organization, but there's an organization that represents the people who will help you to adjudicate your insurance claims on your behalf.
Yeah. Is it the National Association of Patient Advocates? Is that what you're thinking of?
That is not what
I don't know if that's
Sabrina,
the
are
official
you,
one. No.
is this ringing a bell with you?
Not offhand, but it sounds like
If
a
I
great
find the link, I'll share it
organization.
with Catherine.
We have one last question. Maybe you could answer it after the call, since we're running out of time here. But it has to do with cardiology cases where the nature of the condition is hidden, usually because, you know, patient confidentiality and other reasons. So I don't know if I can send it to either or both of you, and you could maybe take a crack at it if you can. But we're at over 1 hour, we're over 45 minutes, and so we should wrap up. But I wanted to thank you both for the great work you did to put the insurance guide together. It's very, very useful, and it's something that everybody, if you do nothing else, just read the overview, and if you're in a state, read your state section. I think you'll find it quite useful. Charlie and Sabrina, we appreciate your contribution to it, and your contribution and your suggestions today. Thank you so much.
Thank you. Bye-bye.